Okay. Hello everyone, how are you all? We'll wait till this gets connected to you all. Instagram is getting a little slow in getting people joined. Hi, how are you? Thank you for joining us here today. Thank you everyone for being here today. We're going to have a wonderful session today. A very interesting session with one of the very renowned doctors. And we'll be talking about the most common symptom of MS, which is optic neuritis. So without wasting much time, and she will help us understand this topic better. Hi, doctor. How are you? I've sent you the request. If you can. Hi.
Hi.
How are you? Good morning.
I'm doing well. I'm just gonna adjust my camera. 1 second.
Yeah, sure.
Okay, there we go. You can see me, right?
Absolutely. And you look wonderful.
Thank you. You do too. You look beautiful as always.
Thank you. I would firstly like to say thanks to you for accepting this request and coming online with us. People have been wanting to hear more and more about this topic, and you are a specialist. You can understand, make us understand this more better than anyone else. So welcome here once again.
And I'm so glad to be here, and thank you for the invitation. It's really a pleasure to be here.
Thank you, doctor. We've been seeing your page. You have been putting very interesting posts and reels talking about headaches and optic neuritis, the vision problems that people have. So we just want to understand what interested you in optic neuritis, ophthalmology, actually. What interests you the most in this?
Yeah, so I mean, if we go back to like when I was a college student, I was actually accepted already into a medical program, and I was kind of exploring different fields to see what I liked the most. And what I would do is during my breaks, like if I had like a holiday break, I would go and I would shadow other doctors to kind of see what they were doing. And you know, I shadowed like different fields. I shadowed pediatrics, I shadowed cardiology and a couple of other ones. And then one of our family friends was actually doing ophthalmology at the time. He was doing his residency in ophthalmology. So he said, hey, why don't you come and spend the day with me and see what I do? And at that point I was like, oh, the eye, I don't want to, you know, it just seemed a little bit, I don't know, it didn't seem appealing, but I spent a day with him, and that day literally changed my life. I woke up early in the morning. I went to the operating room with him. I watched him operate on cataracts. I watched him operate on babies, on older people. And then I saw him in the clinic. And what I realized is that vision is just so precious. And most of us don't think twice about it. We just kind of assume that we'll be able to see. But when it goes wrong, when something goes wrong, it can be really devastating. It can really affect every way that we function. And to be able to restore someone's vision, to be able to provide them with better eyesight, I thought that would be an incredible way for me to contribute. So I ended up doing ophthalmology, and then I was also interested in neurology in medical school. So I was, you know, kind of deciding between ophthalmology and neurology. And I chose ophthalmology ultimately because of the technical aspect, the surgical aspect, because I like working with my hands. But then when I had the opportunity later to specialize, I actually chose neuro-ophthalmology because it kind of brought together two of my passions. So I ended up doing a fellowship in neuro-ophthalmology, which is so exciting. It's so challenging. The eye-brain connection is just amazing. It's so unique. And so it's really, again, great to work with patients and work with them towards restoring their vision.
That's very kind of you. And such passionate doctors only make a difference in the lives of people around the world. And thank you for having this passion and interest and going for this field. And that's how we are meeting here today.
Exactly. Yeah.
So, doctor, so we all know that multiple sclerosis. In multiple sclerosis, the first symptom mostly that people have is optic neuritis. And why do you think is that as a the most common symptom or the first symptom that people have?
Yeah, so it is one of the very common symptoms. And actually, if you look at the statistics, about 20% of people who ultimately get diagnosed with MS present with optic neuritis. Why the optic nerve is so susceptible to demyelination? Well, it's coated in a myelin sheath. It has a very high metabolic activity, so it has a lot of demands. And that's my thought as to why, compared to other nerves, other parts of the body, why is it the optic nerve? I don't have a clear-cut answer, but that's my guess, is that because it has a myelin sheath around it, and it's a very long nerve. It goes from the back of the eye all the way into the brain. So anywhere along that nerve, it can get inflamed. And actually, so optic neuritis, again, 20% of people with MS will first present with optic neuritis, but over one's lifetime, if somebody has a diagnosis of MS, 75% of them will have optic neuritis at some point during their journey with MS. So it's really high. It's very, very common that people will have optic neuritis at some point. Sometimes it's what we call subclinical optic neuritis, which means that people may not even know that they have it. They may think their vision is fine, or maybe they had like a little bit of a blur and they didn't really get it checked out. And then at some point later on in an eye exam, it's picked up, oh, something must have happened to this optic nerve. And then ultimately it's diagnosed as optic neuritis, but the patient may not have actually had symptoms when it was going on. So that can happen as well. Yeah.
Wow, that's so interesting. So 75% people, that's scary too.
It
So
is
how,
scary, but I do have to say that people with optic neuritis, it's very frightening, to lose your vision. And some people have mild vision loss, but some people have complete vision loss where they're not able to see anything, where they can maybe only see some shadows or maybe light and dark. It's really, really frightening to have something like that happen. The good news is that when optic neuritis is associated with MS, the vast majority of people have a great prognosis. Yes, it's scary when it happens, but ultimately they improve. And the studies have shown that people who have optic neuritis actually have a better prognosis, less disability, less frequent attacks with MS. It's a particular subtype, or we don't exactly know, but people do get better, and many people do recover most of their vision that they have lost. So it's scary, but think on kind of the long-term aspect of it, it's not so bad because it does get better.
that sounds like a silver lining. So, doctor, can I know that, like you said, that people sometimes they don't even come to know that they have optic neuritis. So, what are the ways that a person can know that they have this problem?
Yeah, so there are different types of symptoms with optic neuritis. One of the most common symptoms is pain. And I think over 80% of people with optic neuritis have some kind of pain. So if you feel like there's an ache behind your eye, or if you feel like, if you're looking around and it hurts, or if there's like a tugging sensation or tightness or pulling sensation, that could be optic neuritis, particularly if you've had other symptoms that may be MS, or if you've already had the diagnosis of MS. If you feel pain, discomfort in the eye socket, it could be optic neuritis. The other thing is blurred vision. So I mentioned earlier, optic neuritis can cause a range of different types of symptoms, sometimes mild blurring, sometimes more severe blurring, but even mild blurred vision, if it lasts for a few weeks. So, some people will say, oh, I wake up in the morning, my vision's a little blurry, I rub my eyes, and then it clears up. That's not optic neuritis. Optic neuritis is when it's blurry, it stays blurry for at least a few weeks, and then it kind of goes back to normal. So it lasts longer. So it's basically, again, demyelination. So the timing is important there. But those are, I would say, the two main symptoms of optic neuritis are the pain and then the blurred vision. There are others as well that we can talk about, but those are the two big red flags, I would say.
Right. So I also understand that, like optic neuritis, one of the common problems that MS patients do suffer with is migraine. And when a person has migraine, they have problems with their vision as well. And do you think there's any kind of correlation between optic neuritis and migraine? Because this is very common that MS patients have.
Yeah, no, I'm so glad you brought that up because migraine, first of all, migraine is very common in the population.
Yes.
Very, very common. So 1 in 8 people have migraine. But yes, you're absolutely correct. Studies have shown that people who have MS have a higher prevalence of migraine. So are they really related? There's this thought that, okay, we know that MS is autoimmune. Could migraine also be autoimmune? And I've posted about this in the past, is migraine an autoimmune disease? So, you know, these theories have been put out there, but it has not been proven that migraine is autoimmune. But definitely, because migraine is so common in the population, we definitely see the two together. And some of the symptoms can be similar, especially the visual symptoms of migraine and MS. So for example, in migraine, one of the key features of migraine is light sensitivity. So many people with migraine have light sensitivity, but also people with MS have light sensitivity. So are they independent? Are they, you know, merged together? It's really hard to tease it out. But certainly, you know, these are two very, you know, I would say for some people, debilitating conditions. But the good news is they're treatable. They're treatable. And if you, you know, talk to your provider, you know, maybe your MS doctor is not the one you need to talk to about your migraine. Maybe you need to see a separate doctor. Maybe you need to see your MS doctor and a migraine doctor to get the best care. So, so really ask for that, you know, be your own advocate. If you really think you have two conditions at the same time, yes, they may overlap, but really get the best care possible for each of those conditions.
Right. So I can say from my own experience, I am living with MS for last 10, 11 years now. And migraine is something which I have developed since last 1 year. And I was not taking anything for migraine, but since a few months, it's just have been has become worse and worse. And now when I have headaches, I have to take some pills to subside the pain. And yes, I know then if I have migraine, at least for 1 or 2 days, I have to be in dark room, no blue light, and just have a me time sleeping all the time.
Yeah,
That's right.
and I want to just point out, you know, what you're describing is very classic for migraine, but also migraine is not just a headache, right? I want to really make this really a big
Yes.
point here. Migraine, people think, oh, it's just a headache, and I just take some Tylenol, Advil, it'll go away. No, migraine is a neurologic condition. Just like MS is a neurologic condition, it affects the brain, the spinal cord, the eyes. Migraine also affects the brain and the eyes. And so people can have visual symptoms. They can have that light sensitivity. They can see flashing lights. They can have loss of vision. They can have sound sensitivity. They can have nausea. They can have vomiting. It's so much more than a headache. And yes, sometimes people just have to like retreat from the world. They have to go into a dark room. They have to lie down. They have to go to sleep for things to be better. So it really affects function.
Yes.
And people need to realize that. And also, I hate to say this, but patients may realize it, but also their families need to realize it. And their friends and their coworkers, they need to realize that it's not just a headache. And if you need that time to yourself to recover from your migraine attack, take that time. Don't feel guilty about taking that time. Maybe you miss a day of work. Maybe you miss a social event. Maybe, you know, you can't go out to dinner that day, or maybe you can't be there for your child. You know, whatever it is, you need to take that day for yourself to heal from your migraine. It's really, really important. Thank you for bringing it up, because I think it just doesn't get talked about enough.
Thank you so much, because yes, like you said, that your family and your friends, your colleagues needs to know what migraine is. That is, it is not just a headache. That is very important for their understanding. And I can just say that when I get migraine, I feel that, you know, MS and migraine, MS relapse or migraine can just come at any point of time. They both are unpredictable. You're just fine and you're just sitting, and all of a sudden you're like, your one side of your head is paining, one nerve is paining, and slowly you feel, oh, it's coming to my eyes, it's swelling, it's coming down to my cheek, it's swelling, it's coming, then it's going down the whole body, and then the fatigue comes, and then the nausea comes. Oh God, that is horrible. Within few minutes, your entire day can just turn around.
Yeah,
So
and
this is what happens with
it's
MS2.
unfortunate. It can come on like that.
Yeah.
And like you said, the symptoms, I didn't mention this, but you're absolutely right. Some people have not just the pain, but they can develop numbness. They can
Oh
develop
yeah.
tingling. They can
Oh,
have
yeah.
this extreme fatigue. Like I also have migraines. So when my migraines come lately, it really knocks me out. Like I feel like I got hit by a truck, and you just cannot function. You can't think. You can't move. You just want to go to sleep. So yeah, it can be really debilitating. So
So, doctor, do you think that optic neuritis and migraine, they both can be triggered by some things in common?
So
Like
that's a
changing
great
weather
question.
or
You know, a
something?
lot of my patients ask me, you know, Dr. Banik, why did this happen to me? Why did I get optic neuritis? Is it something I did? Is it something I ate? Did I bring it on myself? And what I tell them, first of all, it's not your fault, right? That's the first thing. It's not your fault. We don't know why it happened, but you know, there could be certain triggers. Like I'll just give you some examples for um, just for reference. So one of the triggers could be stress. And
Oh,
we all have stress in our lives, right? But I can tell you with my patients who have recurrent episodes of optic neuritis, I always ask them, tell me what's going on, what's been going on in your life. And guaranteed, they'll say the number one thing, I've been stressed. I've had a lot of stress at work. I've had a lot of stress at home. You know, my health issues are giving me stress. Usually it's a flare-up related to stress. But other things can cause optic neuritis also. Now I've seen this especially now that we're so aware of viruses in the world. Definitely after a viral infection, that can trigger optic neuritis. I've definitely seen it after even, you know, just a cold. Sometimes after a more severe viral infection, sometimes even after COVID, people can develop optic neuritis. It's been published. You know, there are cases of optic neuritis triggered by COVID. Even the vaccination. Not to say people shouldn't get vaccinated because they're too afraid of getting optic neuritis, because that's kind of a very big statement to make, that you shouldn't get
yeah.
vaccinated. But for some people who may be predisposed to demyelination, maybe to MS, that vaccine may trigger the pathway of autoimmunity and trigger optic neuritis. It's happened. I've seen it. So there's lots of things that could trigger it. And same with migraine. Like stress is like the elephant in the room when it comes to migraine. You know, like when you're stressed, you're more likely to have those attacks. And when you're really relaxed, like for me, I know if I go on vacation, I'm really relaxed for like a week or two, I don't get migraines. But as soon as I come back to work and there's the, you know, all the daily things that we have to do, it's stressful. And that can definitely trigger one's brain really into developing an attack. So yeah.
Yeah, thank you, Doctor. Doctor, if you don't mind, can I just take a few questions that's
Absolutely.
come
Yeah,
popping
yeah,
up?
yeah. Yeah.
Yeah. So I can see a question that is there any relation with amblyopia and optic neuritis?
Sorry, was it
Um,
myopia? Oh,
amblyopia.
amblyopia.
Yeah.
Amblyopia. So, not that I'm aware of. So, amblyopia is basically it develops in childhood where one eye doesn't see as well as the other eye, or sometimes both eyes don't see perfectly. They don't see 20/20 or 6/6, and it's because there's different reasons why people can develop amblyopia. Maybe they have glasses. They have a need for glasses, and they weren't wearing glasses as a child, or maybe their eyes are crossing or drifting, and that's why the vision's not developing properly. But amblyopia sets in during childhood. And usually, if it's not treated before the age of 10 or 12, it becomes pretty much permanent, where that vision is never perfectly 20/20 or 6/6. Now, MS or optic neuritis is separate. Yes, it has to do with the pathways, the visual pathways in the brain, but optic neuritis is not a developmental issue. Amblyopia is more of a developmental issue. When those pathways are developing, that's when it can first manifest. So
Okay.
I hope that explained things a little bit. And amblyopia is not inflammation. It is not caused by inflammation. It's caused by other things, but not inflammation.
Okay. Okay. Thank you, Doctor. I can see another question here. Can optic neuritis recur?
Yes, yes. So there are patients who have recurrence either in the same eye or the other eye.
Okay.
And I've seen patients who've had, you know, 7, 8, 9 recurrences of optic neuritis. And in those cases, obviously, we want to do a very extensive workup to see what's going on underneath, you know, all of this vision loss. Could it be MS? Could it be something else? Like, for example, you may be aware of there are 2 other demyelinating conditions that are not MS, but also demyelinating that can cause similar types of symptoms. So there's neuromyelitis optica spectrum disorder, which is NMOSD, which can also cause optic neuritis. And there's MOGAD, which is myelin oligodendrocyte glycoprotein associated disease. It's a very long name, but MOGAD. So NMO or MOGAD, not MS, they're different from MS, but they can also cause optic neuritis and recurrent optic neuritis. So if you've had multiple episodes of optic neuritis, definitely get checked for those two conditions.
Okay. I can see a question saying that what's the treatment for optic neuritis?
Yeah, so as I mentioned earlier, optic neuritis has a very good prognosis. Usually it gets better. If we do nothing, let's say, we don't treat at all, vision does recover. It can take anywhere from 6 months to 1 year without any treatment whatsoever. And usually it goes back to what it was before. There may be some mild deficits in color vision. Things may look a little bit washed out or faded or muted. There may be some deficits in contrast. However, vision usually does recover. The treatment, though, if we want a faster recovery, let's say somebody says, I don't want to wait 6 months for my vision to come back. I need it back right away. I need it for work. I need it for whatever I'm doing. We can treat with steroids. And those are really the mainstay of therapy, is we do steroids. Now, there was a very big study done on optic neuritis looking at almost 400 patients with optic neuritis. This is back in the late 1980s, early 1990s, to find out the treatment with steroids, like how much should be given, how long. So that particular study used IV steroids for 3 days.
Yes.
Okay, so high dose IV steroids for 3 days, followed by 14 days of oral steroids. And people had a much faster recovery. So instead of waiting that 6 months or 1 year, usually within a couple of weeks to a month or two, they're almost back to normal. So steroids definitely speed up the recovery. But when steroids don't work, then there are other ways to give steroids also. Some doctors, I know some neurologists like to give pulse steroids. So they'll do 5 days of IV, but then no oral. They'll just do high dose 5 days of IV. Other doctors will do high dose oral. So 1,000 milligrams of oral steroids, which is a lot to take, but they'll do that as a substitute for IV. But then there are other medications that can be used also. So when people don't respond, let's say they've taken their steroids, they're not getting better, we have other options for treatment. We can do something like what's called plasmapheresis. I don't know if you've heard of this before, but it's much more advanced. It's a hospital stay, because what we do in plasmapheresis is we filter out your blood of all the inflammatory chemicals and cells that are, or immunoglobulins that are triggering the inflammation. So it's usually a 3 to 5 day course of plasmapheresis. Then sometimes other medications can be given, like infusions, rituximab can be given. There's a couple of other infusions that can be given. Other oral medications can be given, like azathioprine. So there's a lot of options out there if steroids are not working, but we usually start with steroids.
Okay. Yes, so that's what happens, that when a person has a relapse, and a relapse can have different new kinds of symptoms, like one of them can be optic neuritis, other can be just pins and needles, or numbness, or any other kind of new symptom. Then what we usually do, that doctors advise a patient to get hospitalized for 3 days and take steroids, and that's how they treat it. So
yeah, that's the mainstay of therapy. But then again, not everybody has access to that. Not everybody wants to go into the hospital. So I'm based in the US. I'm not sure where you are, but in the US, in India. Okay. What we've at least at my institution, at my hospital, what we've started doing is we've started getting patients set up for home IV therapy, which means that they don't actually have to go into the hospital. We set it up through a visiting nurse service. So they come to the home, they put in the IV, and they deliver it. It takes about probably an hour or so. They hang the IV bag. It takes about an hour, and then you're done. And then you can continue doing whatever you're doing, whether it's still going to work or school or whatever you need to do. So it's less, it's more convenient, I would say, than having to go into a hospital for 3 days of steroids or 5 days of steroids.
That's wonderful. That's wonderful. So I have an interesting question here. That can optic neuritis cause permanent damage? Since you said if we take steroids, it can be treated. But will it leave a permanent damage or a mark on the nerves?
Yes. So there's damage, and then there's loss of function.
Yeah.
Okay. So usually most people do gain back their vision. and or their color vision or whatever part of their vision was missing, most people do recover that. The vast majority, not everybody, but the vast majority with MS do recover that. However, on the exam, we can see signs of prior damage. And again, it doesn't necessarily mean that the patient has symptoms, but these are what we call markers, indicators of a prior episode of optic neuritis. So one of the most common things is we look at the optic nerve. So when you go to the eye doctor, most likely you get your eyes dilated, right? You get the drops put in.
Yes.
Your eyes get blurry for a few hours. That's the dilation part. So when we dilate a patient who's had optic neuritis, when we look in the back of their eye, we can see the nerve, and the nerve tends to look a little bit pale. So the nerve, the optic nerve, normally has this beautiful orange-red color, but after optic neuritis, part of it can look pale, meaning it doesn't look like that healthy color. It usually looks a little bit yellowish or whitish. So that's a marker for optic neuritis. Now, there are other tests that we can do that can also pick up previous damage from optic neuritis. There's a tool that we use called OCT. Now, if you've been to the eye doctor, you've probably had an OCT test done. It's basically a high resolution ultrasound of the eye. And it scans your optic nerve, it scans your retina, and it makes this beautiful color-coded printout map of what the nerve looks like. You're nodding, so you probably remember what it looks like. So the OCT,
I remember.
see, the OCT can pick up damage from optic neuritis. And that's why in the very beginning, I was saying some people have never had symptoms, but then on the exam, we can pick up optic neuritis. It's because when we do the OCT test, we can see like, oh, the right optic nerve looks a little bit different than the left. Something must have happened. And especially if the patient has MS or they have symptoms of MS, then we can presume that they must have had an episode of optic neuritis sometime in the past. Now, when you have acute optic neuritis, let's say you start with symptoms, the nerve doesn't look pale right away. Usually it takes about 6 to 8 weeks after the episode starts when the nerve starts to change color a little bit and look a little bit different. So if it's very early on in your optic neuritis, the nerve may look totally fine. It may look healthy, but then after some time, the change sets in.
Okay. That's very informative, and thank you for this information. We did not know what doctors do after dilating our eyes, but they see in it.
It's important. I think it's important for doctors to explain, like, why am I doing this? I'm not just doing it to make you blurry for a few hours. I'm doing it because I'm looking to see if I can pick up anything on your exam that will help guide your diagnosis or your management, or, basically protect your eyes going forward. That's the reason.
Absolutely. Thank you so much for this information. And I also want to know, like, is there any kind of supplements or something, some kind of vitamins that you recommend for people if they're having a vision problem or just to keep healthy eyes? Is there anything that a person should take on daily basis? Since I know that a lot of MS patients are already on lots of supplements. And for example, vitamin D is one of the major one that they take. Also for migraine, people do take magnesium. Is there something that you recommend to the patients for healthy eye?
Yeah, so I'm glad you're asking me that, because I actually have a book coming out soon. It'll be out in the next week or two on nutrition for eyes. It's called Beyond Carrots. Best foods for eye health A to Z. So in that book, I go through like what all the nutrients are that we need, what the foods are that provide those nutrients, not just carrots. And then I have a chapter in that book about supplements. And so I'm not talking about MS, I'm just talking about general eye health. So there are a couple of nutrients that are really, really important for our eyes. And again, I don't really know if they've been studied in MS, but for overall eye health, I would recommend definitely a good B complex, because our eyes need energy, and the B complex, B vitamins are important for energy production by our mitochondria. So we need to have a good B complex. We need to have all the minerals that are important. So copper, zinc, selenium, these are all nutrients that we need, that our bodies can't make, that we need in our diet or to take it from a supplement. And then there are 3 eye nutrients that really don't get talked about that are important for eye health. And these are called lutein, zeaxanthin, and mesozeaxanthin. Have you ever heard of them?
No, I'm sorry, but no.
No. So most people haven't heard about them. And even, in my training, it wasn't really emphasized. But what I've realized is that these nutrients are so important to keep our retina healthy and to keep our lens healthy. So these are nutrients that come from foods. Our bodies can't make them, but they come from foods like leafy green vegetables like spinach, kale, collard greens. They also come from yellow and orange foods. So for example, egg yolk is rich in these nutrients because it has that beautiful orange yellow color. Yellow peppers, orange peppers, even spices like paprika, saffron, curcumin is another spice that's important as well. But there's lots people can do with respect to their diet to support their eyes, a balanced diet with all of these nutrients, but also it may be helpful to take a supplement. So in my book, I talk about the supplements that I would recommend for eye health. Omegas are also really important. I know omegas are great for brain health. So to take a good full spectrum omega, not just omega-3, but omega-3, 6, 7, and 9. So a full spectrum omega. And for those people who may be interested, I've been really busy the past few months. I have a supplement line coming out specifically for eye health. So supplements that I've designed that will have all of those nutrients in them to support your eyes more than, just a multivitamin would support your eyes. So it's really very tailored to eye health. So that'll be in the book as well, just information about that.
Thank you, Doctor. I would request you to share all the details with me, and I'm going to post all this on my page.
Thank you. Yeah, thank you. I really
The
appreciate that.
supplements,
Yeah.
and
But
I
also,
will share
you mentioned vitamin D. It is so, so important. If you have not had your vitamin D level checked, ask for it to be checked. So, so important because vitamin D, yes, it's a nutrient, but it also helps to control inflammation in the body. It's also important for good, healthy hormone synthesis. So get your vitamin D level checked. And I typically recommend, especially for people with MS, I recommend vitamin D levels in the range of 50 to 70. Okay. I know that the range is probably up to 50, but I actually recommend trying to go a little bit higher than that, really to support the anti-inflammatory effect of vitamin D. So shoot for the levels 50 to 70 on the vitamin D.
Okay. All right. Thank you, Doctor. Before we proceed, I just want to say that just 10 minutes are left since the session was only for 45 minutes, and time just flies. I didn't even realize that we have spent so much time talking. It was so informative and so interesting. So I'm just going to take maybe a couple of more questions. If anybody has questions, please write it down here. Dr. While we are talking about optic neuritis and migraine, I know there are a few other problems with the eye when it comes to MS. There are people who have a lot of dry eye problem, and it is chronic eye problem when it comes to MS. It's a condition which is very common in MS patients. So what do you recommend for dry eye people with that kind of problem?
Yeah, so dry eye, there are different causes for dry eye, but the majority of people with dry eye have inflammation as their cause of dry eye. They have inflammation of their eyelid glands that causes the glands not to secrete healthy oils, and then it leads to the dryness. So for them, the mainstay of dry eye therapy is artificial tears. You need to lubricate your eyes. Just like I was just explaining to a patient yesterday who had very severe dry eye. Just like, when your skin gets dry, you moisturize, right?
Yeah.
And some seasons may be more dry than others, but if it's really a dry, season, you moisturize 2 or 3 times a day. Same thing with your eyes. I have patients who say, yeah, I use the drops. And then I ask them, how often do you use them? And they say, oh, maybe like twice a week or maybe once in the morning. That's not enough. If you have dry eye, and especially if it's a chronic problem, you need to lubricate at least 4 times a day. At least.
Wow.
Because you put that drop in, you blink, eventually that drop will fade, and then your eyes will get dry again. So you need to keep moisturizing. The other thing that's really good for dry eye are hot compresses. And I don't know if you've ever tried this before, but it's so soothing. You take a compress, not just a washcloth, because it doesn't stay hot for that long. You take like a pad that has like beads inside, so the beads retain the heat. You heat it up like maybe in a microwave, and then you put it in microwave just for about 10-15 seconds. Then you put it on your eyes, and that hot compress helps the oil glands secrete oils, so your eyes will get less dry. And then the third thing, I'll give you one more tip, is going back to the omegas. Omegas are really important for dry eye. So if you suffer from really severe dry eye or even moderate dry eye, include omegas in your diet, so omega-3s, but also take an omega supplement. it's really, really important to get that omega in for your dry eyes. And it'll help your MS too. It'll help your brain health. So it's good all around, that omega supplement.
Oh, thank you so much, doctor. This is really, really useful. And doctor, I can see a question here. Mudassir has written, please, doctor, how could treatment for intraocular pressure? What is the treatment for intraocular pressure?
So intraocular pressure is pressure literally inside the eye. And when it's elevated, then we worry about glaucoma. So it's a particular eye condition that can cause damage to the optic nerve, also different than MS. But when the intraocular pressure is high, we think about glaucoma. And so there's a bunch of tests that need to be done if you have high eye pressure, and your eye doctor can do those tests. And if necessary, if you need treatment, then they would probably put you on drops to lower the eye pressure to protect your optic nerve. Oh, okay. There's a lot more. I could talk for hours on this, but I'm just going to answer, in that brief 1 minute answer to that question.
Thank you, Doctor. So I'm going to just take last two questions probably. Okay, there's this question, don't sweat glow. Why does my left eye shake all day?
Okay. So I'm not sure if you have been diagnosed with MS or you're being worked up for MS, but that is something. Eye shaking is a symptom, it's a feature of MS. And it's reflective of a certain part of the brain having inflammation. And basically what happens is the eyes normally, when you're looking at something, your eyes are steady, you're looking at it. But when there's inflammation in certain parts of the brain, the eyes can jiggle. They can literally jiggle. So imagine you're seeing your world and everything's shaking. It's a particular finding called, when the eyes jiggle, it's called nystagmus. And when your symptom, when the world is jiggling, when you're looking at something, it's shaking, it's called oscillopsia. So nystagmus and oscillopsia are the reasons why people may have that symptom, especially related to MS. And in the acute setting, like if I have patients who come in and all of a sudden they have this jiggling, and then we discover that they have MS. So it may be the first symptom of MS, but if it is MS related, we typically do the IV steroids, like I was explaining before. We'll do IV steroids, maybe a short oral course as well. But if it's chronic jiggling, then it becomes a little bit more tricky to treat. There are medications that can be used to help to decrease that jiggling. So instead of maybe jiggling like this fast, maybe it's only jiggling like this. So definitely, if you have that, talk to your doctor about what the best treatment options would be. Yes. But I'm glad you brought that up, because yes, there are people who experience that and they don't know why it's happening. And the reason it's happening is it's because of inflammation or demyelination in the brain, most likely.
Thank you, doctor. I'll just take the last question here. Press News has written, doctor, sometimes I have baggy eyes and the bottom part gets red and swollen. Also, my eyes gets really teary. What could be the reason?
So in that case, if you have a lot of swelling, bags under your eyes, it could be that you're allergic to something. That's a very common reason, some kind of allergy, maybe something in your home, your environment, that your eyes are reacting in that way. And so it's causing the swelling, usually there's itching as well. I don't know if you have any itching, or sometimes it can be discharge, like a whitish discharge or yellowish discharge, sometimes even crusting. Your eyes may be glued together in the morning. So these are all symptoms of eye allergies. But also, if your eyes are tearing, this is really interesting. People don't realize that when the eyes tear, it's because they're actually dry. It may seem really contradictory, like, why, I have dry eyes, why are my eyes tearing? Well, the reason is because if the surface gets dry, there's a signal that gets sent to the tear gland, which is up here underneath the lid, and the tear gland overproduces tears in response to the dryness. So the dryness is the reason why you're tearing, because your tear gland is trying to compensate and lubricate. So in order to prevent the tearing, you have to treat the dryness. So do what I said earlier, use the drops frequently, use the hot compresses and the omegas, and that should help with the tearing as well.
Wow, that's so surprising. I'm so glad that we are talking and we are getting so much of information and so many details from you. Some things which we have never even understood or known before. Thank you so much, Doctor, for sharing such a lovely information about everything that we wanted to know. Thank you so much for being
Thank
here.
you. Thank you for having me. And I enjoyed all the questions. I enjoyed, our chat, our discussion. Yeah,
Thank you,
absolutely.
Doctor. And congratulations on your book. And we are looking forward when you release your book. We would love to share that with our
Oh,
community.
thank you. No, I really
Along with the
appreciate it. I will
supplement.
definitely send you a message once it's out. And again, I'm hoping, fingers crossed, it's going to be out next week. I really, because every week I say it's going to be next week, and there's always a delay. There is always some kind of delay. But I said, you know what? When the time is right is when it's going to happen. So I'm waiting for the time to be right.
Yeah, it's said that God sees his truth, but waits for the right moment. So your right moment is coming.
Yes, that's so true. Thank you for that. I'm going to use that if you don't mind.
Thank you so much, Doctor, for everything. We are just so grateful that you were here with us today. Thank you so much.
Thank you. Thank
Have
you.
a lovely
It's
day.
so nice to speak with you.
We'll
Bye-bye.
do this again later when you have time.
Absolutely.
Thank
Bye-bye.
you. Okay, bye. Have a good day.
You too.
Thank you everyone for joining us here today. This was such a lovely session with Dr. Banik, and we learned so many things about optic neuritis, about migraines, about dry eye problem that people hardly talk about. So this was really informative, and so grateful that Dr. Banik was here, and she's a wonderful person. And I would like to say that everybody who enjoyed the session and want to know more about osteoarthritis, migraine, and the other issues, follow Dr. Banik on Instagram, and we'll be, of course, tagging her on our post. And we'll also be sharing the book that she'll be releasing along with the supplementaries that she'll be releasing. We'll be coming up with more sessions this month, and hope to see you soon. And stay tuned with us. Thank you so much. Have a lovely day.